Welcome, everyone. I am Sheri Weiser. I'm a professor of medicine at UCSF and a founding co-director of UCSF's new Center for Climate, Health, and Equity. Today's session is the last of our three-part speaker series that we're hosting with a goal to really engage our community working at the intersection between climate change, health, and equity. In today's session, we're going to be focusing on how to capitalize on those synergies between the climate, racial, and health justice movements. This series is being co-hosted by the Office of Population Health and Health Equity at the UCSF School of Medicine, as well as by our new Center for Climate, Health, and Equity. I would like to extend a special thank you to our series co-chair, Dr. Kirsten Bibbins-Domingo, and also to Dr. Ariane Teherani, founding co-director of our center and my partner in crime in this work. I'd also like to thank our collaborating partners and our planning and advisory committee, and particularly Dr. Courtney Lyles, Jessica Fields, Jennifer Monroe Zakaris, Naomi Byler, Sarah Shear, and Anne-Marie Charlesworth for invaluable contributions to this lecture series. We have what I think is a wonderful lineup today. We're going to start off with introductory remarks by Dr. Dan Lowenstein. Then Dr. Kirsten Bibbins-Domingo is going to provide an overview of how climate change acts as a multiplier of racial and health injustice. Kirsten is then going to be moderating what I think will be a very exciting panel discussion with leaders in the field of environmental justice. So to get us started, it is my pleasure to introduce Dr. Dan Lowenstein. He is the Executive Vice Chancellor and Provost at UCSF, as well as the Robert B. and Eleanor Aird Professor and Vice Chair in the UCSF Department of Neurology. He is a clinician scientist, an expert in the basic science and clinical aspects of epilepsy, and an avid and highly regarded teacher. Dr. Lowenstein has played an active role at UCSF as an advocate of diversity and civil rights. And importantly, he has been a real champion of the work that Ariane and I have been doing to try to advance the Center for Climate and Health and Climate, Health, and Equity. So please welcome Dan. Welcome, Dan.
Thanks so much, Sheri, and welcome to everybody. I'm really glad and excited to be here with everyone this afternoon as we focus on the convergence of climate, racial, and health justice. And as you heard, this is the third session, which is part of the UCSF Population Health and Health Equity Spring 2021 speaker series. And so far it's covered in session one, the urgent threat of the age of big wildfires. The second session was on the cascading health risks, climate change, food security, and migration. And now today, it's session three, more than ever, movement building for climate, racial, and health justice. So, I mean, who would argue that solving any one of these climate crisis, racial justice, and health equity on its own is a tremendous undertaking, much less two or all three? The thing is, we have to, because they're intrinsically linked. It's in our mission to advancing health worldwide, and UCSF is devoted at every level to serving the public. And so health equity, it's at the core of what we do. And how can we achieve this without also striving to eliminate institutional racism? One example of how UCSF is approaching this is through our Clinical and Translational Sciences Institute, better known as CTSI. And CTSI is dedicating funding to support pilot studies investigating racism and its effect on health, including issues such as the impact of police killings of Black people on community well-being. Now let me bring in climate. California has gone through several years of, needless to say, historic wildfires, and wildfires lead to poor air quality, which increases asthma and allergy attacks and can lead to other illnesses, hospitalizations, and deaths. And as research has shown, environmental threats to human health are not experienced equally among populations. So it's imperative that we investigate environmental contributors to human health and disease through the lens of our most vulnerable populations and seek to identify and advocate for systemic solutions by health professionals and community members. And again, now more than ever, to succeed, we need to think about completely new strategies for organizational change. taking on anti-racism work and climate action will require new thinking, multi-level strategies, and an intersectional approach. One way we're doing this is looking externally and thinking about different ways of working with community. For example, the efforts of the Differences Matter Research Action Group for Equity, also known as RAGE, which is to increase the diversity of our scientific workforce and the participants in research. Another one, the Accelerating Systematic Stakeholder, Patient, and Institutional Research Engagement, or the ASPIRE project, is collaborating with the CTSI Community Engagement Program to strengthen the role of Black community members and other communities of color in the design and conduct of research, including recently establishing a UCSF-wide COVID-19 Research Patient and Community Advisory Board. And given the certainty of more severe climate change, and boy, have we been warned about that, and this coming year could be a particularly difficult one, it's imperative that the impacts not deepen our egregious racial divide nor further related health inequities. So, as your Executive Vice Chancellor and Provost, I can tell you that UCSF is committed to, number one, supporting and committing to the vision and the mission of the Center for Climate, Health, and Equity to advance equitable and just climate solutions that promote human health and a healthy planet through research, education, health system sustainability, and policy. And secondly, committing to promote and support the broader Bay Area and California community working on climate change, working on environmental justice, and working on anti-racism. So with that, I'm really excited to see this collaboration between the UCSF School of Medicine Office of Population Health and Health Equity and UCSF's new Center for Climate, Health, and Equity, where we can be in dialogue with partners, learn from the experience of others, and think concretely about solutions for the big and interconnected challenges of our time. So again, thank you for allowing me to join you today. We are embarking on a journey that will not only eliminate unnecessary suffering, but also make a positive impact on future generations, and we can do it together. So I look forward to hearing Dr. Bibbins-Domingo highlight some of the key things going on in the environmental justice space and the intersections with health, and to the panel discussion with leaders in environmental justice. With that, I'll hand it back over to you, Sheri. Thank you.
Thank you so much, Dan, for your very insightful comments and also for your leadership. So it's now my pleasure to introduce Dr. Kirsten Bibbins-Domingo, who's the Vice Dean for Population Health and Health Equity in the UCSF School of Medicine. She's also professor and chair of the Department of Epidemiology and Biostatistics and the Lee Goldman Endowed Professor of Medicine. Dr. Bibbins-Domingo co-founded the UCSF Center for Vulnerable Populations at Zuckerberg San Francisco General Hospital and has been a national leader in cardiovascular disease prevention research to advance health equity. She's also former chair of the U.S. Preventive Services Task Force and recently chaired the National Academies of Science, Engineering, and Medicine Consensus Panel on Integrating Social Needs into Healthcare Delivery. We look forward to your presentation, Kirsten. I'll turn it over to you.
Great. Thank you very much for the great introduction, Dan, and to Sheri for the kind words. I'm really thrilled with this series and thrilled that we're ending this series with this important topic, climate change, and it's how racial justice, health justice, and climate justice converge. In thinking about the importance of this topic, it is clear that climate change is really a multiplier of these various types of injustice. We see that racial, economic, and environmental risks converge to deepen the health inequities. And it's an understanding of this that really helps us to see why it is not only important to understand their link, but that solutions involve putting the inequities and the racial justice front and center. We know that low wealth, Black, Indigenous, and communities of color disproportionately suffer the burden of air and water pollution associated with the fossil fuel economy, that these communities are disproportionately and heavily impacted by climate change, and have the least access to affordable energy, active and public transportation, safe and affordable housing, and climate resilient health infrastructure. Climate change and racial injustice are driven by overlapping systems of racism and exploitation. And this diagram here from one of our speakers, Dr. Linda Rudolph, really highlights how both these forces reinforce one another and why solutions have to actually address these issues at multiple levels. So I'd like to make 4 points in these remarks. The first is that the fossil fuel industry is a driver of climate change, environmental racism, and the health inequities that we seek to address. We know that communities of color experience the impact of air pollution in multiple ways more than other communities. This is documented here in the disparities in pollution from these various sources: construction, power plants, industrial, residential, experienced greater in Black America compared with white America, and certainly all people of color experience this on average more than white Americans. These, of course, are the industries that are also the biggest drivers of the impacts of climate change. They contribute the most to climate change. We know that among people living near refineries exceeding EPA's level of hazardous emissions, 62% are people of color. In the Gulf Coast, the heart of oil and gas industry, residents there have amongst the highest rates of cancer, asthma, COPD, premature death, and low birth weight. And it's the Black, Indigenous, and other communities of color in these areas that are inequitably impacted. We know that these inequities have historical roots, from slavery to redlining, historical redlining, and even active current redlining. And this analysis highlights that redlined neighborhoods have, on average, 5-degree hotter temperatures than non-redlined neighborhoods across all regions in the United States. The second point that I would make is that communities of color and low wealth communities experience climate change health impacts first and worse, and yet have contributed the least to climate change, again, amplifying the inequities that we are highlighting here. This was an analysis that showed different groups' contribution to air pollution, as well as their then exposure to air pollution, by deconstructing the various industries that contribute to air pollution and who benefits from those industries. And with this analysis, white Americans have a pollution advantage, experiencing 17% less air pollution exposure compared to the amount of air pollution that is caused by their consumptions. In contrast, Black and Latino Americans have a pollution burden, experiencing far more exposure to air pollution than to their consumption. The trends in all groups, fortunately, have declined over time in terms of exposure to air pollution, but the inequities have not declined at all over time. And you see this pollution inequity gap staying fairly stable over the last many years. That's true in the US, but we see the same thing, of course, globally. This is the map of the world if one were to look at historic contributions to emissions and see which parts of the world are most responsible for the historic contributions. We can also look at emissions by who are the current contributors to emissions. But that pales in comparison to who is actually most impacted by climate change, where you see the large and disproportionate impact in the global South. And of course, in the US, we are have a much smaller area on this map, but within the US, of course, the climate change is not only hurting our poor communities the most, but also in many ways helping those communities with more resources. And this really highlights the stark and growing inequities in economic damage associated with climate change. The third point I would make is that climate change solutions can provide tremendous health benefits. But unfortunately, it is access to these solutions that are inequitably distributed, and thereby reinforcing racial, health, and economic inequities. And so many of the solutions that we have talked about over the course of this series, solutions that relate to housing, relate to transportation, public and other forms of transportation, solutions in terms of energy solutions, all of these that have the potential to have beneficial impacts of health are in fact those types of social determinants of health that again follow the same patterns of inequities. And so the very solutions for the communities that all of us are affected by are least available to the communities that are most affected by climate change. The last point I would make is that climate change solutions should center racial and health justice and follow the leadership of the most impacted communities. Otherwise, they risk reinforcing the inequities that we've observed. And what I would argue here is not only is this a moral and just approach to our climate change solutions, it is in fact the only way that our solutions will ultimately be effective. One sees here that our indigenous populations, indigenous peoples who make up a small proportion of the overall world's population, but who manage or have tenure rights for a very large share of the world's land. Solutions in terms of land conservation, by definition, need to involve indigenous communities if they are to be effective globally. California, of course, has been a leader in terms of addressing climate change, but we know that programs by themselves will not have equitable outcomes unless health equity and social justice are centered in the design of these programs. And we see this in California's cap and trade program. If you look at the industries, the facilities that were the biggest emitters, these are disproportionately in those communities of color, in neighborhoods where communities of color reside, and more often in disadvantaged neighborhoods, in economically disadvantaged neighborhoods. And this analysis of the effect of these programs in California, which was designed, in fact, to reduce greenhouse gas emissions, found that the majority of these facilities in these areas reported higher average emissions since the initiation of these programs, really highlighting how inequities will be the result of programs unless social justice principles are baked into the design of these programs from the outset. And this is really highlighting here how these programs over time had a disproportionate burden on people of color, people with lower socioeconomic status. These programs can be designed to reinvest in these various communities. And so these design has to be inherent in how these programs actually are conceived of and therefore then implemented in more equitable ways. It shouldn't be surprising to you knowing how these communities, Black communities, Latino communities, and other communities of color are disproportionately impacted by climate change. It shouldn't surprise you that Latino Americans and Black Americans are more concerned and alarmed by global warming than others, in this case, white Americans. It shouldn't surprise you that Latino Americans and Black Americans are more likely to join campaigns to convince elected officials to reduce global warming because of the disproportionate burden, in fact, that these communities experience. However, it is often the case that the public face of those who are involved in environmental organizations are more likely to be white, and in fact, in this analysis, more likely to be male. And I think highlights the ways in which our perceptions about who is behind these movements, who thinks most about these movements, is not actually reflected in sometimes the faces that we see in leadership here. That is, of course, not the case in our panel today. We are really thrilled to have a really outstanding set of panelists to talk to us about these issues and their convergence. I'm really pleased to welcome Ms. Veronica Garibay, Dr. Rupa Marya, Ms. Amee Raval, Dr. Linda Rudolph, and Mr. Alvaro Sanchez. These are outstanding leaders who I've been thrilled to get to know as we prepare for these discussions. And what you'll hear today is their leadership in their individual organizations. But also what I want you to hear and listen to is how much centering on racial justice is important in the work and the impact of their work over time. And so I'm really looking forward to this discussion today and pleased to welcome them each to our screen right now. Hello and welcome. Oh, I see all of you. That's so nice. So I want to begin. Before we begin with the panel, let me encourage each of the our viewers that if you have questions, you can put them in the Q&A tool on Zoom. It's at the bottom of the screen. Later in the session after the panel, we'll come to some of those questions for discussions. I will also say that our speakers have really extraordinary bios and we want time for the discussion. And so I hope you will go to the links that are in the chat and to go to the website to learn more about them, each of them individually and their organizations. But I'm going to give each of them an opportunity to talk about their organization. And I want to focus in first on the organizations that you each represent. Each of you, your organizations focus on power dynamics, clearly in recognition of the fact that the climate problems you each want to solve are fundamentally linked to social, economic, and political problems. So I'd like you to describe the work of your organization and why you see racial justice as a cornerstone in advancing climate and health equity. Veronica, can I start with you?
Sure, thank you. Hi, everyone. Good afternoon. Thank you for having me today. I'm excited to be here. My name is Veronica Garibay. I'm the co-founder and co-executive director of Leadership Council for Justice and Accountability. We're an 8-year-old organization based in the San Joaquin Valley and the East Coachella Valley, so inland California. And we work directly with lower income communities of color across these two regions. We're partnering right now with approximately 30 neighborhoods and community groups in these two regions, and sort of working hand in hand on a number of issues, including a lot of what was just laid out around climate change, racial justice, and health equity. At Leadership Council, we sort of work on the interrelated issues of land use, housing, transportation, water, climate, agriculture, public investment, and good governance. And so while that sounds like a laundry list of issues, when we launched the organization a couple years ago, we felt really strongly that all these issues are interconnected and must be addressed as such, especially as they converge and sort of impact communities of color, Black, Indigenous, and people of color communities directly. And we learned in organizing in these communities, and I've lived in the Valley my entire life, and from the Valley is home to me, have learned that we cannot, that communities are not facing single issue challenges. They're not just facing issues with safe and affordable and dignified housing, or access to safe and affordable drinking water, or access to transportation, good air quality, that a lot of these issues are sort of inherently interconnected and must be addressed in that way. Otherwise, we continue to perpetuate these cycles of poverty, exclusion, and racial injustice in many ways. And so, our work has really been centered on working directly with community residents. And when we launched the organization, to speak sort of the importance of racial justice is recognizing that the communities who are facing these issues and confronting the issues are people of color communities. And for anyone to not be aware of that, I think is really problematic. And as a state, as a region, sort of we've chosen to look the other way when these issues, when confronting the issues or trying to address the challenges and identify solutions that in many cases, at least for the regions we're working in, have been false solutions and have perpetuated such stark inequality when you look at rural versus urban issues. And so when we started the organization, and this is a little bit from personal experience as I was growing up in the Valley and being tracked as a student and being going away to college, is always heard over and over again, Veronica, we want to empower you and we want to empower you. And every time somebody said that to me, it was as if I had nothing to contribute, that it was chipping away at my lived experience, at my family's experience, at my work and just life growing up in the Valley and how that meant and how my parents and my family experienced life in the region, and felt that was taking away a lot of what we come to the table with. And so it was as if someone is telling you that you're not enough or don't have enough to even sit at the table. So we have to empower you with something in order to sit at the table with us. Mm-hmm. And so when we launched Leadership Council, we sort of launched our co-empowerment model, which from the get-go, and I hope that sort of and believe that there's a lot of organizations and leaders, including many on this call, who sort of take this approach where we recognize and acknowledge, elevate, and respect the inherent leadership, wisdom, skills, expertise that lives in communities, and especially communities of color, that needs to be elevated as we identify solutions to these crises that we're facing in our homes, in our communities, and in our region. And so I think for us, the work has grown tremendously over the couple of years, and as the regions that we work in continue to grow and experience large shares of population growth when compared to the rest of California, how important we are to the rest of the state, and how critical it is that when we're talking about solutions to addressing the climate crisis in a way that centers the health, well-being of communities of color, we have to do so in a way where we're not, as was just noted, perpetuating false solutions that just create more problems instead of set us back. And the last thing I'll end with is, I'm the San Joaquin Valley is home, and we're always at the end of some joke or the end of like, oh, well, Fresno, Bakersfield, Merced, you're that place that we drive through on our way to the Bay or on our way to Southern California, or you're on the bottom of every list: air quality, educational attainment, health outcomes, park access, you name it, it goes on. And what I'll challenge everyone who's listening today and being part of the conversation is to not think of this region as a deficit region, but actually from someone who's from here and lives here and this is home, that this is a region full of opportunity, full of resilience, and a beautiful culture that exists that is unmatched in many ways in other parts of California. And that focusing on that and making sure we're following the leadership, knowledge, and expertise of community residents to sort of address these issues is the way to go. So I'll stop there, and thank you.
Thank you so much, Veronica. Perfect. Rupa.
Thank you so much, Veronica, and thank you, Kirsten. My name is Rupa Marya. I am the co-founder of the Do No Harm Coalition. We are an organization of healthcare workers who are committed to dismantling structures that impede health for our community members. And one of the main structures, or one of the principles, is through dismantling systems of racism. And as Kirsten did say, climate change is a multiplier of racial injustice. We also argue that climate change was caused by racial injustice. I also speak today from the perspective of as the co-founder of the Deep Medicine Circle, which is a new organization that is partnering with Ramaytush Ohlone people, who are the original people of the San Francisco Peninsula, on an incredible land rematriation project in San Gregorio in the San Mateo County. I just first want to acknowledge where I'm speaking from. I'm speaking today from the occupied unceded territory of Huchin, Ohlone territory. I'm speaking as the daughter of Punjabi immigrants who was born and raised in Ramaytush Ohlone territory on the San Francisco Peninsula, because trillions of dollars were stolen from my own homelands through colonialism. And my parents didn't see a life for themselves with their families in the abject poverty of India when I was growing up. And I think it's important to, acknowledge UCSF, where I practice as a physician, where my children were born, is also on Ramaytush Ohlone territory. So it is a great honor for me to be doing this work with them. So we see the root cause of climate change as being caused by racial injustice, being caused by the removal of indigenous people who kept these places in great ecological balance for thousands of years. The places on planet Earth where indigenous people have their sovereignty and are in charge of the forests and the places they manage happen to be the places on planet Earth that have the greatest biodiversity. And that kind of biodiversity and intelligence comes from a cosmology, a way of understanding life in relationship to the web of life around us and to each other. That was really destroyed through colonial capitalism and the arrival of systems of extraction to this land. So even before the fossil fuel industry, which I think, as you pointed out, Kirsten, is a very important target for our work in climate change, we have to understand that that mindset was already here with the extraction of silver and gold from the Americas at the time of colonial conquest. Mountains were riddled, rivers were poisoned with mercury. Some of that poisoning still remains. And the indigenous people were forced into enslavement and into debt or murdered. And so this kind of mentality that can remove beavers from rivers, remove salmon from rivers, alter the flow of water through our own state of California, where now we're at a place where our whole system is going on fire in ways that we've never seen before. This is the direct outcome of disrupted systems of knowledge that come from the communities that are still here and need to be uplifted into positions of leadership. And so that is what we are doing together on this farm, 38 acres down on the San Mateo coast. We are working with the Ramaytush Ohlone to move that land back and to bring the system back into ecological balance. We are reframing farming, the act of farming, as an act of care, an act of ecological care, offering great employment to farmers to care for the soil and care for the water. And what we hope to show is that by returning land to indigenous people, by reasserting their sovereignty in their own homelands, by bringing back their systems of understanding and providing space and security for those systems to reattach since they've been removed for 250 years, we can lead by following as settlers on colonized land. We can create new culture together where care is advanced, care of the people and care of the earth is advanced ahead of any sort of exploitative system. So I'm very honored to be here. I think that these conversations are critical. I think that it is also important to serve my healthcare community by demonstrating exciting ways to work with community groups. Thank you very much.
Thank you. Thank you. Amee, can I ask you to go next?
Yeah, thank you. Good afternoon, everyone. My name's Amee. I work with the Asian Pacific Environmental Network, or APEN. And really happy to be here with folks to share more about our work. So APEN is a grassroots space building organization. We organize working class Asian immigrant and refugee communities around a multitude of issues to really advance our vision for healthy, thriving communities. APEN was formed in 1991 after the first People of Color Environmental Summit. So we've been organizing for over 25 years. A fundamental part of our work is building community power and amplifying the voices and vision of our members as the decision makers for the policies and programs that impact them and that shape their communities. So building power looks like a broad set of strategies. Fundamentally, we're doing local organizing and leadership development with our members in Richmond and Oakland. Specifically, we organize Southeast Asian refugee communities who are living on the fence line of the Chevron refinery in Richmond, and that's where a lot of our historic work has happened, fighting against extraction and the health impacts that arise from living in close proximity to pollution and that industry. We've also been organizing in Oakland, Chinatown. Our members describe Oakland as a walk for pollution, surrounded by 3 major freeways and in close proximity to the port in West Oakland. So these are just some of the sort of the richness of when we say we're fighting pollution and poverty, what that means in terms of the stories and lived experiences in the places we organize. We're also building political power through statewide coalitions and electoral organizing, specifically with Asian voters across the state, which is one of the fastest growing voting blocs in our state, and really is uplifting Asian Americans to be seen. I think our communities often there's a lot of discourse around invisibility in the Asian American community. And in fact, I think we're trying to really resist that narrative and say we have political power and we can not just shape electoral politics, but government across all levels and scales. And then finally, we're doing policy advocacy locally as well as at the state level and making our voices heard in Sacramento. And so when we talk about racial justice, we're really uplifting our members who are immigrant and refugee communities. Many are elderly and are monolingual communities speaking Lao, Mandarin, and Cantonese. We're also organizing youth and think of our vision for environmental justice as really being enabled and led by intergenerational power building. And I think a lot of our campaigns really kind of uplift those stories and that power across the communities we work with. And I just want to uplift something that was shared. There can be a deficiency sort of orientation or mindset and language with the way we talk about our communities as sort of disadvantaged or low income. And I think what we really say is our communities have had to be incredibly resilient. We do take that sort of asset-based approach, not just sort of in the face of historic disinvestment and deep systemic failures, but especially thinking about immigrant and refugee communities, the resilience of our stories of sort of making home in a new place and creating community and cultural enclaves, whether that be Richmond, Oakland, or communities, everywhere. I think we really want to uplift that there's a lot of resilience and innovation embedded in our communities. And I'll share a little bit more about that when we talk further.
Yes, that's something I really want to come back to that both you and Veronica in particular have really highlighted. Alvaro, can I have you speak next?
Yes, of course. Hi, everyone. My name is Alvaro Sanchez. I'm the Vice President of Policy at the Greenlining Institute. The Greenlining Institute is a 28-year-old research, advocacy, leadership development organization and policy organization based out of Oakland, California, but we take a statewide approach to all of our work. Greenlining envisions a future where communities of color can build wealth, live in healthy places filled with economic opportunity, and are ready to meet the challenges posed by climate change. And to do this, we focus on economic equity issues, climate equity issues, and more recently, we're focusing a lot on helping communities lead the change that they want to see themselves by providing technical assistance and capacity building resources to the work that they do. And to describe kind of why racial equity really matters to the work that we do, I want to talk a little bit about the first time that I saw the COVID-19 map of Oakland and what communities were being most impacted by that disease. I couldn't help but notice when I saw the COVID-19 map of Oakland that it had a striking similarity with 2 other maps that I'm very familiar with. One is a 1937 redlining map of Oakland. For those of you that don't know, redlining is a practice that intentionally restricts investments in parts of American cities based largely on the race of the people that live there. And the second map that it looked very familiar to was the CalEnviro screen map that California uses to identify the communities that are overburdened by poverty and pollution. If you put all those 3 maps together, what I was witnessing at the time was the undeniable effect of racism. And that's really the root of the problem that we're trying to address as an organization. As the speakers have already mentioned, all of these issues are interconnected, and they stem from root causes that have been built on a way of white supremacy, of oppression, genocide, and extraction. But from the perspective of greenlining, these ideas have been scaled, reinforced, and enforced by the public sector, the private sector, and other parts of our system that continue to exacerbate these inequalities. So for us to address the bigger picture of the impacts that communities are facing, we know that it's not just going to be around addressing one need that communities have, but it's going to take holistically reimagining the economy and society that we all live in. When I talk about my work and I talk about environmental work, I often say that I don't want to just have or achieve a cleaner planet. I want to achieve a planet where more people can live, thrive, and not be worried about the injustices of the past determining their future. So for me, what we're trying to solve is a much bigger picture, problem that we have. And all of us, I think, collectively are trying to get there. But that's why it's so important for us to think about the work that we're doing interconnected to all of the issues that communities are experiencing, but also that racial equity is at the core of what we do, because these root causes are not going to unsolve themselves. They need to be solved through strategic, initiatives that includes the way that government, addresses the inequities that they themselves have created. So look forward to talking to the rest of the panelists on this.
Thank you so much. And Linda.
Thanks so much to Kirsten and Sheri and the whole team that's put together this panel and for inviting me to participate. I work as a policy advisor with both the Public Health Institute, which is a non-governmental public health organization, and the Medical Society Consortium on Climate and Health, which represents over 30 national medical societies. And over the last couple of years, I've been the de facto coordinator of a very ad hoc coalition of national public health and medical organizations that have come together informally to advocate for policies that simultaneously promote climate action and health equity. And we're doing this because we know that nurses, doctors, and other health professionals are consistently among the most trusted groups in the United States, both by the public and by policymakers. And they have a lot of credibility. We have a lot of credibility, especially when we're talking about health issues. There's also an emerging body of evidence that shows that when people understand that climate impacts health and that climate solutions have immediate health benefits, they're more likely to support robust climate action. So we believe that mobilizing the health voice and health expertise is an important strategy in addressing the climate crisis. The first thing our coalition did was to develop a shared policy action agenda in 2019, a call to action on climate, health, and equity. And I should note that this actually drew heavily on a global call to action that the UCSF Global Health Group was instrumental in developing in 2018 with some international partners. Recently, we've developed more specific recommendations based on the policy action agenda for the Biden-Harris administration in general and for the US Department of Health and Human Services, again, with very broad endorsement of these recommendations across the health sector. And we've been discussing these recommendations with administration officials in OMB and HHS, with Gina McCarthy, with the new EPA administrator, really trying to bring the health voice into the conversation about climate. We've developed policy briefs on our recommendations. We've been training health professionals to become more actively engaged in advocacy for healthy and equitable climate action. So for example, Physicians for Social Responsibility and EcoAmerica's Climate for Health program both offer climate and health champion trainings. The Medical Society Consortium is training 6 Southeastern Climate and Health Fellows in collaboration with the National Medical Association. And we have a network of state-based climate and health organizations that are providing peer support and engaging in local, state, and federal advocacy on climate. Today, the Consortium, NRDC, and Wisconsin Health Professionals for Climate Actions released a new report documenting that in the US, we're paying over $800 billion in climate-related healthcare costs every year. So we're really trying to use many avenues to bring the health voice into the policy arena, advocating for these policies. The policy agenda is very grounded in a framework, and thank you, Kirsten, for showing the framework in your remarks, that recognizes that the root causes and upstream drivers of climate change and health inequities are one and the same. Our energy, land use, housing, food and agriculture systems are at the same time the key contributors to climate pollution and the key shapers of the community living conditions that largely drive persistent health inequities, drive the nation's chronic disease burden, and drive our out of control healthcare costs. We also know that those systems and related inequities didn't happen by chance and thus are not immutable, and that the climate crisis, racial, economic, and environmental injustice are all associated with power imbalances, structural racism, discriminatory policies that others have addressed, higher pollution burdens, and inequalities in access to resources for health and for climate resilience. So my first job as a physician was as a union doctor working for the union that represents refinery workers, including those at the Chevron refinery. And I learned a few things in that job about the power and the tactics of the fossil fuel industry, but I really did not appreciate then the extent to which the powerful and wealthy, both individuals and corporations, are willing to exploit people and exploit our natural resources, even to the point of risking human survival for profit. And it's now very clear to me and to a growing number of other health professionals that without building political and economic power and voice for those that are most vulnerable, most impacted, and least responsible for our climate crisis, we won't be able to transform our systems to address either the climate crisis or to build healthy and climate resilient communities. I think a really important question for the health professionals and health organizations that I work with is how we can build meaningful and impactful alliances and collaborations with the kind of power building community-based organizations that are represented here so that we can most effectively use our health expertise, our health message, and our health voice to support the systems and social transformation that we need to avert catastrophic climate change. And I look forward to the rest of the conversation to help answer that question.
Wonderful. I know we are going to run out of time with this conversation because there's such richness in the comments that we've already started with. There are three themes that I hear when we had the chance to prep for this, and I've heard in your remarks, and I want to explore now a little bit more. The three themes for me are about community power, about policy, and about partnerships, and how centering on the issues of social justice, we can use those to advance the goals that we're talking about. And I want to start first, perhaps with Veronica and Amee, who talked about the power in communities, and to give us more specific examples about resilience in these communities in the face of the onslaught of the climate crisis, as well as the health crisis that are affecting the same communities, and perhaps the work of your organizations in building resilience or in working with the power that, Veronica, as you say, sits with these communities already. Who would like to start? Amee or Veronica?
Do you want to start, Amee?
Sure, I'm happy to. Yeah, so I mean, it's been made clear, but I think all of us living in California are acutely aware that California is being pushed to extremes. And the past couple years of record heat, fire, drought, and pollution all have one thing in common. They were made worse by climate change. And a lot of scientists are saying, you know, we've lost complete control and that there isn't a normal anymore. And that when you add these crises together, the impact is cumulative. But what we really uplift, because we've been doing environmental justice organizing for decades, is that there's nothing new about cumulative health impacts for our folks. And they've been plagued with the burden of polluting industries for generations. And so we've been fighting since the beginning. One of our historic campaigns at APEN in Richmond was in direct response to an explosion that happened at the Chevron refinery that sent thousands of people and residents in Richmond to the hospital for burning sort of eyes, sore throats, a range of really acute health impacts, in addition to sort of the chronic impacts from living near it every day. But amidst that, there was guidance for shelter in place sort of responses. And at that time, this was in the 90s, the phone alerts from the health department were only going out in English to let folks know what to do. And so a lot of folks who are monolingual that don't speak English were left out and shut out of the response of knowing what to do. And so we fought through a campaign for a multilingual warning system that was in place to make sure all residents were included in those systems. And I think that foundational campaign has really paved the way for a lot of the current work we're doing around climate response and just recovery. Because we see traditional models of crisis response failing our communities. Often they're coordinated through militarized entities like sheriff's departments. They might rely upon protocols like evacuating to faraway sites, and the alerts might be still in 1 to 2 languages. And as well, some shelters require ID to access services if it's a government institution. And so we've been really seeing, not just amidst climate crisis, but even sort of the pandemic, communities really showing up for each other. We've seen schools providing food to thousands of families. We've seen neighbors form mutual aid networks to share resources. And libraries were turned into cooling centers and clean air respite centers when conditions are really extreme. So these are sort of those examples of community-led responses of really capturing and harnessing that power. And we've been really pushing for the government to invest in those types of community-led models, including models like resilience hubs, places people can go not only during disasters and shocks, but every day, trusted spaces like libraries and health clinics and schools to sort of provide economic and social support to neighbors. So we really want to uplift those models. There's not one size fits all models, but this is happening across regions in the state to really show, I guess, demonstrate that community power we're talking about.
Veronica?
Yeah, I think echo a lot of what Amee just said. I think just looking at just even in the last year alone with the impacts of disproportionate impacts of COVID-19, I think that when we fully understood, I think the scope and scale of what COVID-19 was going to be back in February of 2020, I think many of us knew that Black and Brown communities were going to get hit first and worst, that the emergency response systems were not set up to provide resources and support to workers, to families, to tenants, to children, to schools. And in places like the San Joaquin Valley and the Eastern Coachella Valley, where the public health infrastructure is so limited, and especially in rural areas where it's basically non-existent, we knew that there's going to be serious both sort of environmental, social, and economic impacts to the communities that we were working with. And you know, one thing that happened early on, COVID-19 in the regions we work in became very politicized very, very quickly. And part of it is what we were hearing at a national level and what was coming from the administration at the time. We work in very politically conservative regions. There are glimmers of hope here and there in both regions where there are really strong elected officials who are trying to do the right thing. But predominantly leadership is politically conservative. And so, you know, Amee just said one thing, we militarized response. Well, in a lot of the places, it was the sheriff's departments who were going around providing PPE to agricultural farm worker communities. Well, what do you think that does to undocumented populations? And who do you think will come out to a testing site that's being staffed by the sheriff's department? That, you know, in rural areas, there was no, it took 7 months to launch mobile testing sites in rural communities where there are no local health clinics, where there is no infrastructure. And that wasn't, that was a response by community residents who organized and pushed local decision makers and primarily the state leaders and private healthcare providers to work with them and partner with them to respond to the crisis. And the other thing I'll point out is, as Amee said, you know, that in many in looking back at response and recovery efforts, the way everything was online, it wasn't phone-based, it didn't take into account the fact that so many people don't have access to broadband. And so then the response was like, well, everybody has a smartphone nowadays. And so everybody can look at stuff online. And it's like, well, when you're a family who has limited data plans and you have to choose between your child going to school or following up on school or healthcare services, what do you think they're going to pick? And so there was just, I think that a lot of issues that we weren't prepared for, that we should have been prepared for. And community residents, as Amee just noted, quickly mobilized and were much more effective at sharing resources and information with one another than local public health departments were, and any other sort of government agency trying to respond to the COVID-19 crisis. It's how information was put out. You all have heard about the stories around food processing and meat packing facilities in the San Joaquin Valley and the impacts that those, how workers were impacted, they weren't protected. You know, if you all haven't read the investigative report by the Fresno Bee, where the local Fresno County Public Health Department tipped off Foster Farms as to when Cal OSHA was going to inspect their facility, that in and of itself should tell you a whole lot about what is happening in the Valley and when we value economic profit over people. And so I'll say that to say that community organized, so in response to what lack of worker protections and safety precautions, a lack of information around how to stay in your home and tenant protections, how to access food, because of what was happening, really came together and were much more effective and much faster at mobilizing a response. And, you know, there are resilience hubs, and the reality is that those are really, really helpful. Sometimes it's really difficult to do so when infrastructure and physical spaces don't exist, especially in rural areas, for that to happen. So we have been working with Amee and others on the panel today to sort of elevate these issues and the power of community to organize, because Amee said this earlier, communities have had to be resilient for so long. We've had to fight for our survival for so long, despite all odds, despite insurmountable barriers, have worked to sort of elevate, to sort of make sure that we're okay, future generations are okay, our communities are okay. And there's community residents who will talk about when one part of your body hurts, you're impacting the whole. It's not just, trying to protect you and your community, but you're doing this for the sake of future generations. And so I think that the power that exists in communities to mobilize, to network, to advance what they see as priorities is critical. And we often, as practitioners, as advocates, as government staff, public and private sector, fail to look at that and fail to see that, fail to understand how invaluable that is and how much we have to follow their leadership.
Yeah, I love that, and really bringing it home with our current pandemic too, and the response in these, and then calling out with what Alvaro said, these are exactly the same communities that in the face of our current infectious disease pandemic are also the same communities, both suffering the health consequences, but also having the power to address those, because as Amee said, we've been doing this for decades already, and that's where the power has come from. I'd love to talk about policy. We've talked about the policy solutions, and Alvaro and Linda, you really work in this realm. We have a new administration at the federal level. We have the governor with a new budget at the state level. I'd love if you could tell us what do you think are the policy issues that we should be looking towards or supporting, or where the opportunities are in the next year that you think will really make a difference, and what you think that we should do in the policy arena. Alvaro, do you want to start?
Sure. Thank you. Happy to. And well, Linda and I answered these. My fellow panelists, they do a lot of the policy work themselves. So I appreciate their support in all of this work. I mean, I'll start by saying that, something to look forward to in the next year or two is really for us to have just a lot more ambition, to be a lot more bold with our proposals, both at the state and at the federal level. But also, I really want to encourage us to think about not just committing to racial equity, but actually practicing it in the way that we develop policy approaches. And I always like to make that distinction, because it seems like it's much easier to just commit to say you're going to care about racial equity. But then when you're thinking about implementing it and developing it and actually measuring it or analyzing it, the practice of racial equity is actually fairly new. And a lot of people don't quite understand how much change you need to include in your policy development when you really are committing to a real practice of racial equity. So I want to highlight the fact that Greenlining, along with a lot of other colleagues, we're pushing for the state to establish a statewide office of racial equity, because we think it's really important for government to practice racial equity. Because again, like I said before, inequities are embedded in the way that our policies have developed up to this point. So it's going to take government, an intentional government approach, to undo those inequities and to analyze future policy proposals from an equity lens to figure out whether or not those proposals will exacerbate inequities or address them, including how we think about our budget. So included in the Office of Racial Equity proposal are recommendations for us to study our budget through an equity lens and figure out whether or not our spending is addressing inequities or exacerbating them. It will include asking legislative proposals to go through an equity screen so that we can understand the equity implications of future policy and hopefully develop more anti-racist policy in California. And it'll require state government agencies to develop racial equity action plans, so that, again, the practice of equity is not something that's just given to one individual or one office, but rather it's something that is shared across all governments so that everybody practices racial equity, and it's not just someone's job to do, because it really should be all of our jobs. So that's actually something that's really important for us as it relates to policy, because really it's going to take all policy to address the climate crisis, and it's going to take all economic policy to address the climate crisis, and all safety policy to address climate crisis, because all of this is interconnected, as we said. And at the federal level, I think we have really excellent opportunities with this administration, because at least they've taken that first step. They've acknowledged that this is a problem, and that climate change, economic crisis, and COVID-19 are impacting people of color first and worst. So that's actually super big, because we just came off of an administration that didn't believe racial equity was an issue at all. So the fact that we have an administration that's open to these ideas and thinking about that, and already proposing proposals that are actually making progress towards that goal is really important. And now we have to have them deliver on those commitments. And again, I go back to, they're committing to racial equity. Now we need them to practice it and deliver it. So hopeful that the American Jobs Plan includes racial equity approaches, that their executive orders on racial equity deliver, and that their Justice 40 initiative, which actually mirrors a lot of what California has done on climate equity issues, actually delivers real equity outcomes across the country. So those are just a couple of things to share, and I'll pass it over to Linda.
Thanks, Alvaro. Well, we're about to invest huge amounts of money at both the federal level and the state level. And there's a lot of commitment to investing in climate mitigation and resilience, and at least the stated intention of really trying to make sure that these billions at the state and trillions at the federal level of dollars do redress some of the existing inequities, racial and environmental. And so I think that's very exciting. There's a lot of really good proposals on the table, but I think we could do a lot better in terms of making sure that those investments get the best bang for the buck by simultaneously addressing climate, health, and equity all together. So just for example, there's never been real investment in building transportation infrastructure for walking and biking, even though we know that that would have huge impacts on health and health inequities. So we'd like to see $1 billion investment in active transportation, walking and biking infrastructure in California. That's not on the table right now. We know that there's communities across the state, but especially in the Central Valley and the Inland Empire, that are facing very significant threats from extreme heat. We should be substantially increasing investments in urban greening and urban forestry that we know are effective in offering some cooling and preventing heat illness, which heat does kill more people than any other climate disaster. We would like to make sure that every community has places to go that offer cooling in the heat and offer clean air during wildfire smoke, and that hospitals and public health agencies have the resources they need to respond to these increasingly frequent climate disasters. And we'd like to see an investment in the tools we need to actually analyze the health equity impacts of proposed climate solutions so that we don't inadvertently exacerbate health inequities through our climate investments, cap and trade being just one example that Kirsten showed us earlier. And this is something that the health community has been asking the Air Resources Board to do for over 10 years. To no avail. And the final thing I want to point out is that there has been persistent disinvestment in the public health system for decades now. And we should have seen in COVID that we can't disinvest in our public health system and still have the kind of robust public health response we need when there's a public health disaster, whether that's COVID or a climate health disaster. So it's unbelievable to me that we are not seeing proposals for investment in both our public health system and to prepare our healthcare delivery system to be more resilient in the face of increasingly frequent climate disasters that have caused many hospitals here in California and across the nation to basically have to shut down for weeks to months because of climate disasters.
Can I respond to that? Thank you for bringing those up, Linda. I was appointed by Governor Newsom to the Healthy California for All Commission, and we're actually meeting tomorrow to discuss a unified financing plan for healthcare in California, including but not limited to single payer healthcare. So right now, going through California, the legislature is AB 1400 or CalCare, which is a bill to advance single payer in California. Now, because climate change is already impacting brown and Black communities throughout our state, this is a critical way that we could address the intersection between climate, health, and racial justice is by all of us pushing and getting on board on AB 1400 now. Tomorrow's meeting is from 1 to 5. It's public. I encourage everyone listening to be a part of it and comment publicly on it. I would also say we need a declaration of the rights of soil in the state of California. Soil, we're sitting on 43 million acres of the best carbon sequestration technology we have, which is biodiverse soil. So the more the biodiversity of the soil mimics what we see in a deciduous forest with a fungal to bacterial ratio of around 5:2, the more biodiverse that soil is, the more rapidly it sinks and sequesters carbon into stable soil organic matter. Right now, the impact of industrial and conventional farming in California damages that really rich soil food web. And that those chemicals that are applied onto our soils are all from the fossil fuel industry. So we need to advance a fossil fuel-free food system. In addition to that, we need to end the de facto slavery that is the labor practices of our farm workers that our farm workers are subjected to in California. That includes abolishing ICE so that people, when they're running away from wildfires and forced into shelters, that they're not encountering this militarized presence that adds additional burden of stress and trauma to their families. So to understand, if we're going to say that all these systems are connected, we as healthcare providers have to understand how these multiple things converging together then impact, end up in our patients' bodies. I ended up, I'm going to give a small pitch for this book that I just finished called Inflamed. I wrote with a political economist, Raj Patel, and ecologist Raj Patel, where we're looking at how the intersection of all of these things that have been caused through the colonial capitalist mindset have led us to this moment in history where we are right now, and to what we are seeing and what COVID just showed us so glaringly in our faces. I would argue policy I would like to see next year is giving all the land back to California Native tribes, all the forests back. We have grossly mismanaged our forests in California, and we've grossly mismanaged our waters. And those two things are, critical to why we are burning. So those are policies, I think, that are possible and just require a little bit more imagination on our parts. Thank you.
Excellent, excellent. We have questions from the audience, and I'm going to wrap them into a question that I want to pose to each of you. You've each talked about or alluded to the types of partnerships that are important, the types of collective action that we need to take in order to have an impact. But we know that that within these partnerships are the same types of power dynamics, oftentimes that can be difficult to navigate, that have themselves are rooted in historical injustices. Part of the reason we put on this series is because we want to think about how we as a healthcare institution, an academic institution, a teaching institution, work to address these issues together in partnership. But of course, we come with our own history. So I would love each of you to talk about what does it mean to be a good partner to you? And some of the questions that we've had have been, what can doctors in training, which is, we're oftentimes speaking to those who will be the next generation of leaders, what can they do to do this work well in partnership? So who would like to start? Alvaro?
Sure, I'm happy to get us going with just one thought. I mean, one of the things that we have been encouraging academic institutions and research institutions to do is really to know where you're starting from. So we're really encouraging people to do internal equity analysis about where you're at as an institution when it comes to racial equity. This includes things like understanding the demographics of the staff that you have compared to the people that you want to partner with. Do you have the appropriate level of cultural awareness around how to approach those individuals? Do you have a definition about what racial equity means for your own internal department? And is that something that's well known and publicized and people share that perspective across the board? Do you have the available resources to be able to compensate for people's time when you're actually asking them to do an interview or to partner with a research project for you? So it's really important for your institutions to do that internal work first, to know where you're starting. And then once you have that information, to be able to meet people where they're at. So often we want them to come to what we're doing without actually realizing, well, they're actually at a much different place. And we could do a lot to meet them where they're at, as opposed to having them do all of the kind of jumping hurdles to get to where we're at. So I think real partnership is, really understanding where you are at, understanding what you're asking to do, and then being a partner and being able to meet people where they're at, so that you can accomplish things together. So that's something that I'd like to just share with y'all.
Terrific.
I would just, in that vein, I think that there's a few principles that we kind of uplift, because I think all folks on this panel, we're all part of multi-stakeholder, cross-sector partnerships, especially with institutions that have a lot of positional power, whether that's government or academia. One thing we say is really fundamentally, as in partnerships we enter in, is an intention towards building authentic and trusting relationships. And that's just something that is just an approach we have to take in the way we build relationships. There's no guidebook. It's more of a sort of seeing each other's dignity and humanity. And I think to practice that, it means, not having, I think to what Alvaro was sharing, not having a problem statement or proposal already sort of developed out of and we need to check a box on community involvement. And so can you, we feel tokenized when there's that extension, versus let's co-create project goals and a vision together about what we need. And really thinking about just moving away from a transactional mindset and extractivist mindset that is rooted in white supremacy, but thinking about, well, how can we build a partnership that makes our impact transformational? And something as simple as just listening and making space for community leadership and voices, being open to critical feedback when we get it wrong. These are all, again, just the types of ways, the quality that we work together that so often are missed in partnerships that go wrong. And so I think just leaning into some of those human qualities can actually open some of those doors in a more trusting way.
Veronica?
The only thing I'd add to what Alvaro just said is we don't need to be saved. So don't in addition to everything, and maybe that's more crass, but it's an extractive sort of and transactional approach to the work. But so many times we hear from academic institutions and other institutions of positional power that come and say, we want to do this for you, or we can help you do this, or we're going to do it. It's almost sort of this savior mentality that you approach, and colonialist mentality that you approach communities because they need to be saved because they can't do it on their own. So just wanted to add that point.
Fantastic. Linda and Rupa, you're both physicians, and I'd love you to take it from the lens of the question asking for what do you want to tell physicians who are in training, who are coming up, who really are passionate on these issues, and from your experience of working in partnership, and what does that mean?
Yeah, I think everything that our friends here, our panelists said is right on. I would add that in my own experience, what's been very useful is none of the work that I've done has been initiated by me. It's been requested of me. It's been invited and actually commanded. That from heading to Standing Rock to witness and serve as people were being brutalized by the state and by a fossil fuel company. The Lakota grandmothers who sat me down and lectured to me about my settler colonial privilege and my lack of humility as a physician. And being in that situation and sitting and listening and learning and crying, and then getting lots of hugs and saying, okay, now help us build a clinic. And so going through that process and being unafraid to give away your power, because the power of physicians was built on a colonial system that was meant to extract the labor of the indigenous and people and the slaves here. So this system that we're built on, we have to understand the history and legacy of these violences within medicine, and how our own teachings have been inculcated in an invisible way in our own practices. And so not being afraid to shed that power and to sit with people and to make good friends, and then to follow their invitation and follow their commands. So I say, if you have an idea that you want to do, if you feel like you want to lead an anti-racist effort and you're not from an affected group, then maybe sit down. Or if you want to lead a climate action thing and you're not from an affected group, sit down. But if you are being asked to go to as a physician, to go speak with or on behalf of the health issues, or to use your expertise, to use your white coat privilege to advance the agenda of the communities as defined by them, their health agendas, I say go for it. That is the way I feel that we can really transform medicine into a very a just along more of a sign of justice. So I'm excited about that work. That's I hope that sits right with the people who are asking those questions.
So
Excellent.
I would
Linda,
second what Rupa said about the importance of working with humility and recognizing that physicians and other health professionals do have expertise that can be very helpful and valuable for people in communities and for policymakers, and that all the people that live in communities have knowledge that is also important and valuable. And I think, you know, it's important to try and figure out how do we put together those kinds of knowledge and then use the power, whether deserved or not, that particularly physicians have to advance solutions that are those that meet the needs of the communities that physicians want to serve. You know, I've seen many times where having physicians talk about what they see in their clinic in really impacted communities is very powerful. Should it be as powerful or more for a community member to tell their story? Of course it should, but that's not always where we're at. So I think the really important thing, I also think it's super important for health professionals to be honest about what they do or don't know. And otherwise we lose our credibility, which is one of the few things that we really can offer. And I think it's very important also that we share information bi-directionally, you know, that health professionals really listen to what communities and the organizations that work in them say, but also that we do have expertise and knowledge that we should be sharing more freely. And trying to put that together. And then, you know, it does matter for physicians to speak up about climate change and about racial justice, and to make it clear that these are paramount health issues of our time, way more important in the long run in terms of the health of our patients and communities than much of what we do in healthcare per se.
thank you very much. I have Sheri joining me to telling me we have like just a few minutes left. And I wonder if you could comment then on if there's one final thing you want to leave our panelists, our audience with. The rest of the questions that we have are really related to what concrete actions we can take. And we are asked to take these now in this panel, in this series, to address the issues of climate change and to address the issues of racial injustice, right? And so if you could give that one concrete step that you would like to leave your audience with, what would it be, if there's something that you could share with us in our last few minutes?
I'm happy to start and just, do you want to go, Veronica?
Oh, go for it.
I really appreciated Rupa's point about like being sort of like, if there's a call to action to join us, to really like mobilize. And so I think that is something I want to offer, to like join us in the mobilizations, the grassroots organizing, whether that be on the streets where people are, you know, resisting, doing defense work, protesting, but also through signing petitions and calls to action to call legislators on policies that we're really uplifting and amplifying, needing support for, to move bold and transformative policy action. And I also think like, so my work is in research, and for the academic community, like there's definitely an extension around, you know, community partnered research efforts. And so in a way that really values and sees our expertise. And so if there's ways that, you know, to Linda's point, there's partnerships that can help legitimize and really sort of amplify the community lived experiences that we're uplifting for the sake of moving on shared goals. I think like we have more power working together. And so we do want to broaden these efforts, and really excited to see UCSF like playing this role to hopefully create opportunities for linkages.
Great. Veronica?
You know, Rupa and Linda made really good points, and Linda said, the power of what physicians testifying or elevating what they're seeing in their clinics, especially in rural areas. I cannot underestimate how powerful it's been for physicians who have spoken up about what they're seeing in rural communities when it comes to impacts of lack of safe drinking water in people's homes, and what that does, and how powerful that work has been to advancing the human right to water in California, and advancing, making sure that everyone has access to safe and affordable drinking water. So I think doing that, and being a real partner to community residents, and not being afraid to speak out in public hearings and public settings, as opposed to, you know, I'll send an email here and there, but really standing with community publicly, elevating the very real impacts to overall community health and well-being is incredibly powerful. And then the last thing I'll say is, as research institutions, also, you know, when we reach out for support and understanding the health impacts or climate impacts of proposed so-called climate solutions. So for example, in the San Joaquin Valley, there is this big drive to invest in dairy digesters and biomethane infrastructure and biogas, biofuel development as a renewable energy, as a climate solution. But what that's really doing is really polluting our communities that much more. So working with us to develop that research and sort of be able to put it out in different ways from different groups to demonstrate what the impacts of that are. So authentic partnership in that way is also incredibly helpful.
That's wonderful. So I see that several of you have put wonderful recommendations in the chat. So I'd urge you all to go to the chat to see the recommendations from our panelists. And I really want to thank Veronica, Alvaro, Linda, Rupa, Amee for this really wonderful, enlightening panel discussion. And I wish we had more time, but I know that many will have benefited from hearing what you have to say and the links, and hopefully we'll continue to move on in this discussion. I'm going to turn it over now to Sheri Weiser to close our session.
Thank you so much. That was really outstanding. So much extra appreciation to our panelists and to Kirsten. So in today's session, we've been talking about the synergies among the movements for racial, environmental, and climate justice, and also the fundamental role of systems of oppression in driving both climate change and racial inequity. And clearly, we need to change these underlying drivers if we are able to effectively address the health impacts of climate change. I think the panelists shared what I thought were really inspiring examples of how the most impacted communities are leading this change from local to state and national levels, and also achieving real impacts in shaping California's and national climate policies that benefit all communities. And we see this session really as a starting point and are committed to moving these dialogues and partnerships forward to really shape our climate and health agenda going forward. Reflecting on the 3 sessions of the speaker series, we've been trying to highlight the magnitude and urgency of the climate health equity crisis we're facing. As we've heard, many communities are already experiencing the health fallout of climate change, and this is especially true in BIPOC and low wealth communities and the global south, which unfairly bear the brunt of climate risk, though they have contributed least to the problem. And last time we talked about the fact that we only have 8 to 10 years to avoid the most catastrophic projections of the climate crisis. And if we don't act now, the health impacts of climate change are going to deeply transform every single one of our lives, much more than they do now, similar to what we saw with COVID. And the healthcare sector has a critical role to play here. We're excited at UCSF to help step into a leadership role in this movement, but really being led by our community partners. I think we need to do a lot more than what we're doing, because the health impacts of climate change are so vast and affect all health professions. So we need to be activating every discipline and occupation across UCSF. We need to be building a healthcare workforce that is trained to protect and promote health in the context of climate change. And we need to be mobilizing our institutional influence to help advance equitable climate health solutions. I think what was emphasized most importantly in today's panel is that how we approach this work is of critical importance. We need to be working as true and equal partners with the most affected communities if we are going to achieve the radical paradigm shift necessary to prevent the worst projections of the climate crisis. And doing so is going to ensure that our transition to a low carbon economy follows the healthiest and most equitable path. As Alvaro emphasized, this requires not only at UCSF committing to racial and environmental justice, but also practicing them in real time and over the long term. This also means, as Amee and Kirsten pointed out, that we need to really break down these traditional power dynamics at play and allow communities to lead the way in developing climate solution. And I loved Veronica's point of our need to confront climate change in an intersectional way. Since communities don't face single issue challenges, the most successful approaches holistically address the interconnected injustices. Finally, as Linda and Rupa emphasized, we in the healthcare sector need to stop being silent witnesses to these intersecting systems of oppression. Rather than sitting on the sidelines as we watch the climate crisis unfold, it is incumbent for the healthcare sector to use its influential voice to act. So I'd like to leave us with one question. As health professionals, we took an oath to do no harm. So what does our lack of action mean? It's time that we confront our own inertia and the structural racism and environmental injustice that undermine our ability to secure health and take a stand. We need to be contributing to a paradigm shift away from exploitation of our planet and people and towards a future of human flourishing, rooted in equity, justice, and equipoise with the natural world. We learned through this speaker series that there's a lot to be hopeful about, and we really look forward to what we hope is a new era of climate ambition rooted in collaborative action. On behalf of Kirsten and I would like to thank you all so much for joining us.